So this is Dr. Minotti. We're here with Kristen, who is one of our regenerative medicine patients, and she's now about a little over 2 years after her procedure. We did I believe a lumbar facet injection, some ligament facet injections in the lower back, as well as her left knee. And so if you don't mind just kind of talking about a little bit how your pain was before the procedure and kind of what things have been going on since then, and let you go from there.
Okay. Well, I had started having some lower back problems in that facet joint, and I had a couple of traditional injections where it was under full sedation, where you need somebody to drive you to the surgical center and drive you home, and it took the better part of half a day for both my friend and I, and the out-of-pocket costs were pretty substantial for something like that. So after I started seeing Dr. Minotti just for some general, I'm an equestrian, so balance and strength are very important to me, and and alignment, and being able to maintain that alignment. So I started seeing Dr. Minotti for some range of motion issues, and because I was having difficulty holding a chiropractic adjustment. So when I mentioned to him that I thought that my back injections were wearing off, he said, "Oh, by the way, do you know that I do PRP?" Well, being an equestrian, we've used those therapies in horses for a while, so I knew the efficacy that it had in horses. So I thought, wow, this is great that we can actually apply this to human medicine. And when he told me that it would take 1 hour in the office for literally 25% of what the out-of-pocket costs were for an injection, and I wouldn't need any driver, I said, yeah, absolutely, let's give it a try. So I have had 2 knee surgeries on my left knee, the second of which was an ACL reconstruction and a partial meniscectomy. So I knew that there was going to be some cartilage wear and tear in that knee, and it was starting to flare up a little bit, along with some of the ligaments around the knee, and of course the back injection. So we went ahead, pulled the blood, did the injections. There was a little bit of discomfort to the one directly into the ligament. No problems with the back, no problems into the knee joint capsule at all. The discomfort in the ligament only lasted about 24 hours. It did take about a month to reach full efficacy. So that would have been in February of 2016, and it's now May of 2018. And all of those areas have been stable to this point. I haven't needed any more back injections. I haven't had any more discomfort in the knee or in the back. So I definitely would recommend trying this. I think that if you have a degenerative issue that can be addressed by a therapy like this, it's definitely worthwhile to give this a try before you move on to something more traditional, because it is a therapy that's generated from your own body. I feel like that makes it safe, and it also makes it more effective in all likelihood. And I think that it's a better route to try before you go to traditional medicine, because I can see now the limitations of the traditional back injections, and the fact that they just didn't have the long-lasting effects that you would hope for. And you hate to say that you do something medical because of convenience, but really in comparison in terms of the cost and time investment required, and the superior performance of this type of therapy, I can't recommend it enough.
Are there any specific things that you can think of that you can do now that you couldn't do before, or just do it without as much pain? The back pain, I just don't have it anymore. There are occasions, where everybody's got a little bit of lower back pain in the morning or whatever, but it's just not there. It wasn't limiting my activity, but it sure was limiting my patience with those activities, because it was very uncomfortable. And the same with the knee. Because of the knee, I don't engage in a lot of high impact activities. But when I have to run or whatever, I just don't have any discomfort for it. So it's just made everything a lot easier. And people, if you don't have to put up with the pain, you don't have to. You shouldn't. So. Any other advice you'd give people considering the regenerative injections?
like I said, I think it's worth a try. It is, I think in some ways people might hear that that regenerative medicine and how does that actually work, and that once something deteriorates, is this even possible? And that maybe this isn't actually true at all. But having done my own research before I invested a lot in it for my horses, this is a medical thing. And one of the reasons that they were doing it in horses before people is horses' joints approximate the same size as human joints, which you can't get when you study rats or rabbits or whatever other animals there might be. So really a lot of the PRP stuff, in my understanding, was being pioneered in horses before it went to people. And I read those papers, and it's true. It's founded in medicine. It's a little bit non-traditional. It might be met with some skepticism, but I'm a believer for both my horses and myself.
Excellent. Thank you.